Caseous lymphadenitis, which is also having very good impact on infecting the that means affecting the skin. So it is a chronic contagious bacterial disease that manifests clinically as abscess of peripheral as and/or internal lymph nodes and organs. The characteristic purulent material is very thick and non-odorous. So you can't evince any odor, but it will be of very thick nature. The Corynebacterium pseudotuberculosis, which is considered to be the causative organism of the Caseous lymphadenitis, has a valid claim to be of perfect parasite. Once established in the body, the bacterium can avoid the host immune system with apparent ease and remain there for the rest of an animal life. So once animal is infected by the pathogen, then it becomes a lifelong carrier. That means, so the pathogen will be persistent in the body for almost the entire life of the animals. If left unchecked, the disease is contagious enough to infect the majority of sheep within a flock. It rarely causes enough harm to kill an animal. Even away from its ovine host, the pathogen is well equipped for long-term survival in the environment. So synonymally, this disease is being called as pseudotuberculosis or cheesy gland in case of small ruminants. So when you see the clinical signs, it infections are classically associated with the formation of pyogranulomas. That means the granuloma with pus. These lesions present two main forms which may coexist within the same animal. Sometimes the two forms may coexist in the same animal also. The external form of the disease, also known as superficial or cutaneous, is characterized by abscession of the palpable lymph nodes of the body. Occasionally, the external lesions may appear as a subcutaneous abscess, not directly associated with the lymph nodes. So it will be appearing only as subcutaneous abscess. However, this type of lesion is uncommon even in heavily infected flocks. That means very rarely we used to encounter this kind of subcutaneous abscess problems, whereas the visceral form of the disease is usually associated with the development of abscess within the internal lymph nodes and other organs, their principal location being lung parenchyma. So this is the condition of Caseous lymphadenitis in goat. Even you see the pyogranulomas. So once you make the snake, or if you put a pressure, the pus will be coming out. So Caseous lymphadenitis. So diagnosis is usually the physical examination of lesions associated with the lymph nodes. So suppose that there is a granuloma, that means you have to open the granuloma and see whether pus is coming out or not. Then you have to go for bacterial. We have to go for bacterial culture of suspected lesions. You get able to collect the pus and fluids from the granuloma in this tissue. We can go for bacterial culture, otherwise serological testing. The presence of an external abscess on a small ruminant is highly suggestive of Caseous lymphadenitis, especially in location of peripheral lymph nodes. However, definitely diagnosis is only by bacteriological culture of purulent material from an intact. Generally, in general practice, the bacterial disease, apart from the obvious or overt clinical signs, if you want to confirm it, better to go for culture, followed by your primary, secondary, and tertiary identifications, or otherwise the molecular diagnostics. Animals with visceral abscess pose a greater diagnostic challenge. In such circumstances, we can rely on radiography or ultrasonography to detect internal lesions. Preventions. So generally the antimicrobial treatment, that means you can go for intralesionals or systemic inoculation, that means administration, then supportive care. Control generally by strict biosecurity measures or otherwise elimination of diseased animal from the herd or flock. Then we can go for vaccination, disinfection of shearing equipment and other instruments used for production procedures like castration equipment, air tagging, so between animals, the removal of hazards in the environment that could potentially injure the skin, then pre-purchase examination for lesions, serological screening, and a period of quarantine before introduction of new animals. In much of the world, we see the measures to control cases lymphadenitis in sheep are based on the use of vaccine. In foreign countries, people used to depend on the vaccines. There is autogenous vaccines consisting of washed and formalin killed bacteria are the sole products currently licensed for use in UK. But elsewhere, other parts, if you see, they have been largely replaced by vaccines based on the toxides of concentrated, purified, formalin inactivated PLD. So that means like the way we used to produce a tetanus toxide, here also we can rely on the preparation of toxide by growing the bacterium. That means you have to go for culture in the organisms, then convert exotoxins into toxides and purify it. Then you have to that means formal inactivations. It should be taking almost 4 to 6 weeks in view of converting the toxoid. That means toxin to toxoid. So like that, we have to go for production of vaccines. The regular use of such vaccines within the infected flock has a potential to decrease the gaseous lymphadenopathy prevalence by 60 to 80% within 5 to 6 years. This is at flock level. Then finally, in some countries, a third category vaccine is available, which contain purely toxoids combined with old killed bacterial cells.